Hello and welcome everybody. You are tuned into Blues News Media and I am your host, Lucas Tietzen. Thank you very much for listening in. This episode is going to be a interesting one. It's not going to be inherently filled with any sort of bad news, but instead we're going to go over some discrepancies between what we are told by the mainstream media and what is being quietly reported by some mainstream media outlets, but not as vocal as a lot of the fear that is generally pushed in our day-to-day lives. And to start it off with, this one is from Bloomberg, and it is called COVID-19 Patients Not Infectious After 11 Days, Singapore Study Says. And the article opens with, COVID-19 patients are no longer infectious after 11 days of getting sick, even though some may still test positive, according to a new study by infectious disease experts in Singapore. And that is interesting because, as I have reported on before, you may even test positive after seemingly recovering. And even though you test positive, it does not mean you are sick. It's just showing that within these tests, they are finding the virus cells, but it has been showing that they are actually dead virus cells, but still you come up positive. So it's very interesting how they report those numbers. But it goes on to say that a positive test does not equate to infectiousness or viable virus. A joint research paper by Singapore's National Center for Infectious Diseases and the Academy of Medicine, Singapore said. The virus could not be isolated or cultured after day 11 of illness. The paper was based on a study of 73 patients in the city-state. The latest findings may have implications on the country's patient discharge policy. The discharge criteria is currently based on negative test results rather than infectiousness. Singapore's strategy on managing COVID-19 patients is guided by the latest local and international clinical scientific evidence, and the Ministry of Health will evaluate if the latest evidence can be incorporated into its patient clinical management, according to a report by the Straits Times. And that's very interesting. And then they even have this chart right here for our podcast listeners. It is titled, Feeling Better. Discharged patients outnumbered new infections in Singapore for 7 straight days. And it shows a little black line here, up and down of new COVID cases. And it's basically been steadily declining as the month of May has been going on, with naturally, as we've been expecting, discharge cases from hospitals going up and up and up. Though there was a slight dip there. And it just goes to show you, even by the American CDC's own numbers, this virus was nowhere near as deadly and evidently infectious as we were led to believe in the early onset of all this. I think the fear started really being pushed in March. That's when everything started like closing down and hitting the fan, where it was, you all remember, it was fear, 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 you're going to catch it. Basically, they portrayed it as this some sort of massive virus that was going to kill everything. And as we have been seeing, not only is it anywhere near as deadly, it also is nowhere near as infectious, and more people are getting better right now. So that was very interesting. But the most interesting thing is this is not an isolated incident. This article here, this is being reported by Money Control, and it kind of talks about the same thing though. Asymptomatic patients without fever cannot infect others, says the health ministry. It opens with, as per government data, nearly 80% of India's COVID-19 patients are asymptomatic, and as such, the discharge policy has been revised in the country since such patients can recover at home after spending 10 days at a dedicated coronavirus healthcare facility. It goes on to say that the Union Health Ministry announced on May 20th that pre-symptomatic, moderately symptomatic, and mildly symptomatic COVID-19 patients who have not got fever in the past 10 days do not possess or pose a threat of spreading the infection to others. This announcement follows the May 9th government order, which had tweaked the discharge policy for coronavirus patients, indicating that positive cases exhibiting mild symptoms do not require hospitalization and can recover at home. Lav Agarwal, Joint Secretary of the Union Health Ministry, clarified on May 20th that the decision was taken based on evidence that asymptomatic patients cannot infect others, said a report by Mint. Notably, nearly 80% of India's COVID-19 patients are asymptomatic, the government has claimed. Now think about that, 80%, an overwhelming majority of these COVID-19 cases are asymptomatic. And by the Health Ministry of India's own data, it shows that it is not infectious after 10 days. And we were seeing the whole, you gotta, what was it? Stay at home for 2 weeks to flatten the curve and all that jazz, which has now been stay at home until they find a vaccine, even though that can take months and months and months at the expense of everybody's livelihoods. But that's interesting to note, though. The majority of people are asymptomatic, and they are not that infectious, not only in reference to India here, but also as a study from Singapore. So this is not an isolated incident. But, as should be noted, they can never let that fear go away, because then it wouldn't justify all the draconian measures that they want to enforce in the police state that they want to normalize in our society. Because Agarwal added, I'm sorry if I'm getting that wrong, but he added, the new discharge policy is based on evidence where we have found that pre-symptomatic, mild symptomatic cases, or moderate cases for that matter, not having fever for 10 days will not be able to spread the infection to others. Sorry, I have the garbage truck coming in behind me. However, we have directed that even after a patient leaves a COVID facility, he or she should self-quarantine himself or herself for at least 7 days and also must take all necessary precautions. They should not go out. So even amongst this fantastic news, this is good news, right? It's not nearly as infectious as we were once led to believe. But just in case, you should still not go out. You should still listen to the government. But again, wonderful, fantastic news. And this is another interesting factor in all of this. This one is coming from Sky News. It says, coronavirus disappearing so fast, Oxford vaccine has only 50% chance of working. It opens with, there's only a 50% chance of the Oxford coronavirus vaccine working because cases in the UK are declining so fast, one of the scientists behind it has warned. The University of Oxford's Jenner Institute and Oxford Vaccine Group began developing a COVID-19 vaccine in January using a virus taken from chimpanzees, right when this was first being reported on. But with the number of UK coronavirus cases dropping every day, there may not be enough people to test it on, according to the Institute director, Professor Adrian Hill. He told the Sunday Telegraph, quote, it's a race against the virus disappearing and against time. We said earlier in the year that there was an 80% chance of developing an effective vaccine by September. But at the moment, there's a 50% chance that we get no result at all. We're in the bizarre position of wanting COVID to stay at least for a little while. If it's as deadly and scary and infectious as they say, I don't know about you, when you have these people getting mad at the anti-lockdown crowd saying that, oh, you just want to kill grandma, you want to kill and hurt people. This person is literally calling, hoping that COVID-19 hangs around longer just so that they can make a vaccine. Sure, So some people will say, oh, well, it's just so we can save more people, blah, 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 you know? We don't want more people to die later on when really a bunch of people are getting better. It's disappearing. I thought this is what we would wanted. Oh, but wait, I forgot. There are literally billions of dollars to be made for manufacturing and getting to market a vaccine. And it's so rushed. So it's January. So it'd be like, yeah, 9 months they rushed a vaccine, literally half the amount of time. The holier than thou Bill Gates says that it takes at least 18 months and then at least to generate the vaccine, and then 2 years to see if there's any adverse effects. But naturally, we're going to forego those sorts of studies because it's a race for profit. So this is really, it's interesting. You have the coronavirus disappearing so fast. They don't know if they'll have a vaccine in time. We see that it is not nearly as infectious as we were originally told, being reported on from India and Singapore and Britain, saying that it's disappearing fast. It's not nearly as infectious, and we know it's not nearly as deadly. It's not the biblical end time that a lot of people anticipated this thing was going to be, how they painted it at the beginning of all this. And then another interesting little tidbit that was kind of just, it was just dropped. It was mentioned, but scarcely like properly covered. And that is, the CDC says coronavirus does not spread easily on surfaces or objects. Here's what we know. And USA Today can get lost, but I'm glad they reported on this. It opens with recent guidance issued by the U.S. Center for Disease Control and Prevention sheds new light on how coronavirus spreads through surfaces. Though there is the possibility that coronavirus could be transmitted by touching a surface and then your nose, mouth, or eyes, the likelihood of that is lower than person-to-person contact, which is believed to be the primary way coronavirus is transmitted. COVID-19 is a new disease, and we are still learning about how it spreads, says the CDC's recently updated guidelines. Even though at the beginning of all this, they were so confident that it spread easily on surfaces. So really, they spoke like they knew something, and they were just talking out of their rear ends. Dr. Manisha Juthani, an infectious disease doctor and associate professor of medicine at Yale University, told USA Today that plenty of concern has been focused on packages and groceries during the coronavirus pandemic. The CDC guideline, get the ad out of there. The CDC guidelines, I believe, are trying to reduce fear and paranoia about methods of transmission, she said. More important, she says, is that people must continue to maintain physical distance, wash hands, and try to avoid touching your face. She also advises wearing masks, especially in crowded places. These habits will help going into the respiratory virus season this fall and winter. This update may quell some major concerns about how COVID-19 is transmitted, but there are still plenty of questions lingering. Here's what we know. And then it goes over what we thought happened. This is what we thought we knew about coronavirus on surfaces. Most respiratory diseases, including COVID-19, do tend to last on surfaces, said Juthani. Let's see. Main thing here, a study published in the New England Journal of Medicine found that viable coronavirus could live on some surfaces, such as plastic and stainless steel, for 3 days, while surviving for up to 24 hours on cardboard. 2 weeks after this finding, the CDC report said that genetic material from coronavirus was found on surfaces in the Diamond Princess cruise ship 17 days after passengers left their cabins. And this was at the height of it all. This was really, really pushing that fear that it is everywhere and you could already have it and be spreading it. Neither of these studies confirmed whether coronavirus spread easily on surfaces, but they sure talked like that. In fact, Joseph Vinetz, a professor of medicine at Yale and infectious disease research, said in March that the CDC report has zero relevance to ongoing epidemic or to the ongoing epidemic. And yet they talked as if that was the end all be all thing. Look how long it lives on there. And at the same time, it doesn't really matter though. It doesn't show that it actually spreads that easily. But naturally, out of an abundance of caution, however, frequently cleaning surfaces and washing hands became the norm whenever discussing coronavirus on surfaces, as they chanted to themselves, "This is the new normal," wiping down surfaces repeatedly. Now, how long does coronavirus live on surfaces? Generally, the harder the surface, the longer the life of coronavirus. Coronavirus can survive on glass for up to 96 hours, according to a study by the Journal of Hospital Infection published in January, at the height of the fear. As stated earlier, coronavirus can last on plastic and stainless steel for 72 hours or 3 days, on cardboard for 1 day, and on copper surfaces for 4 hours. Juthani notes that the process of a person getting infected with COVID-19 by touching a surface requires the outer shell of the virus to remain intact, which remains difficult with proper hand washing and surface cleaning. And we should all be washing our hands, so it shouldn't be an issue. If surfaces are cleaned, or even if you touch a contaminated surface but then wash your hands properly, the low risk of transmission from a contaminated surface becomes even lower risk. So it's unlikely you'll get this anyway through touching an infected surface, but it is even less likely if you wash your hands, which we should all be doing anyway. It doesn't really justify the new measures that they've been putting in place. If I touch an area infected with coronavirus, will I get it? Transmission through surfaces is much less likely than other forms of contact, the primary mode being person-to-person contact in an enclosed space for a long period of time, says Juthani. If you wash your hands several times a day, particularly after handling objects that others could have touched, the risk of transmission is significantly lower from an already lower risk of transmission event. So there you have it. Not only is it not as infectious as we thought, and that's being reported on in Singapore and India, and it's disappearing incredibly fast in the UK. And now we are seeing that it does not even spread easily through touching surfaces. Yet that is the line, that is the lie that they used when they wanted to put in the digital dollar in the very first stimulus package. They were saying how, it could spread so easily on money. We got to get rid of cash. We have to save people. And lo and behold, it doesn't even spread that easily. It's almost like they're trying to push an agenda. It's almost like the government wants to know what you buy, when you buy it, for total control, while at the same time shutting down so many businesses, leaving millions of unemployed with their hand out, trying to just take whatever the government can give them. It just makes you think, if it's really not that deadly, why are we still continuing all of these policies, these measures? It's a little bizarre. But with this in mind, it doesn't spread easily on surfaces like they originally told you. Asymptomatic people, the majority of people that get this thing, are not as infectious as we originally thought. And it is disappearing so quickly, we don't even know if we'll have a vaccine out in time to capitalize on this monetarily. But that's not all. Maybe you're not convinced. Maybe you're like, oh, well, there's still person-to-person transmission. That can still happen. We still got to wear masks. We still got to be, somewhat worried. Well, to all my normie friends, family, and listeners, I love you. I respect you. And I really just want to put this in front of you just to get your thoughts, because it definitely conflicts with what we are constantly told in the media, which is what a lot of people have been believing. Now, this is from the National Institute of Health. This is U.S. government approved, Department of Health and Human Services verified. This is cream of the crop, straight from the oppressive horse's mouth. And it's a study on infectivity of asymptomatic SARS-CoV-2 carriers, or COVID-19. Now, the background. An ongoing outbreak of coronavirus disease 2019, or COVID-19, has spread around the world. It is debatable whether asymptomatic COVID-19 virus carriers are contagious. We report here a case of the asymptomatic patient and present clinical characteristics of 455 contacts, which aims to study the infectivity of asymptomatic carriers. The material and methods. 455 contacts who were exposed to the asymptomatic COVID-19 virus carrier became the subjects of our research. They were divided into 3 groups: 35 patients, 196 family members, and 224 hospital staff. We extracted their epidemiological information, clinical records, auxiliary examination results, and their therapeutic schedules. Results. The median contact time for patients was 4 days, and that for family members was 5 days. Cardiovascular disease accounted for 25% among original diseases of patients. Apart from hospital staffs, both patients and family members were isolated medically. During the quarantine, 7 patients plus 1 family member appeared new respiratory symptoms, where fever was the most common one. The blood counts in most contacts were within a normal range. All CT images showed no signs of COVID-19 infection, no severe acute respiratory syndrome, coronavirus 2, or COVID-19 infections was detected in 455 contacts by nucleic acid test. The conclusion? In summary, all 455 contacts were excluded from SARS-CoV-2 infection, and we conclude that the infectivity of some asymptomatic SARS-CoV-2 carriers might be weak. Do you get it now? Do you get it? So not only it doesn't spread easily on cash, they're showing that it does not spread easily with asymptomatic people. Your rate of infection, or your likelihood of infecting people drops dramatically. It is disappearing so fast that they can't get a vaccine out. And now the US government is even saying that asymptomatic people are unlikely to infect others. It's incredibly weak. I don't know about you, that's checking off all the boxes. It goes against everything that we are told in the media. And yet, this information is there. It's out there, but it is scarcely reported on. It makes you wonder, why are we implementing all these measures? Why are we upending the way we conduct ourselves in productive society over an illness that is nowhere near as deadly as we thought, that is nowhere near infectious as we thought? It's concerning, to say the least. But as always, don't take my word for it. I'll have all these articles in the show notes. I strongly urge you to go read them and spread them yourselves. But as always, thank you very much, everybody, for tuning in. This was, again, not so much a bad news episode, but this is what we're told, and this is what is quietly being reported kind of episode. And I hope you enjoyed it, because I certainly enjoyed reporting on it. As always, please like, share, subscribe this video. Any support that you can throw our way here at Blues News Media is greatly appreciated. We're on the big ones like Facebook, Twitter, YouTube. We're on the lesser known ones of Minds, Library, and BitChute. So there are many ways to find us. Please, please reach out. And as always, if you want to contact us personally, email us at bluesnewsmedia@protonmail.com, and we will get back to you. Once again, thank you very much for tuning into this episode, and as always, if you take one thing away from this, hopefully it'll be this: ignorance isn't bliss.